Hi class, my name is Jeannie Francois. I will be going over my presentation. Um, my question is, will implementing physical activity programs and nutritional education programs reduce the rate of obesity among Latino adults within 6 months? Obesity has been associated with significant health problems and increases the risk of many serious diseases such as shortened lifespans, heart disease such as CAD, higher rates of other diseases such as diabetes. The rates of obesity are amongst highest in the Latino men, surprisingly. Well, with around 81.8% of Latino men overweight or obese versus the national average, which ranges from 40.3% to 46.4%, which is a high number. Depending on the age of the men, this problem impacts this demographic the most. Thus, applying an intervention to populations of Latino men is of dire importance as current trends suggest that present programs to help reduce rates of obesity haven't been effective for Latino population. This indicates that the health problem impacting this cultural community has not been adequately studied, and this intervention hopes to find out if programs specialized to be culturally sensitive to Latino population may be effective in reducing the rates of obesity. The intervention is train and educate, excuse me, measure health, coaching, and assistance. Intervention details. The planned intervention includes providing training and ongoing coaching to participants regarding how to eat nutritiously and about the impact of physical activity on health, and training and coaching regarding how each patient may incorporate more activity in each of their lives. After the 6 month period, each patient's metrics will be rechecked to examine whether this intervention had any impact on the health problem of obesity. Stakeholders and patient population. The patient population in this intervention study are Latino men at or over the age of 50 living in California. Stakeholders in this intervention include the patients themselves, their families, trainers, and coaches. The academics organizing and overseeing the study, health professionals who will collect the data and measurements from the patient, and professionals who will follow up with patients after the 6 months. So it takes a whole team. The founders of this study are the government at this study, as the study will be sponsored by a government grant. Community assessment findings. According to the community assessment finding, the strengths of this study includes the topic that is being studied. There is a verifiable problem and need regarding rates of obesity in Latino adult men, and thus growing strongly merits further study. The gaps in the study include any long-term data or results, which will not be provided as this study will only last 6 months. The opportunity in this study include learning more about the cultural impact experienced by individuals in the Latino community and whether an intervention sensitive to this will prove beneficial. Challenges the study may face include cultural barriers, of which we'll be discussing in the next slide, and managing the needs of patients that may change over time in relation to what resources that are available for the study. Cultural implications and barriers. It is important that the intervention is designed to be culturally sensitive, as there are social and cultural elements likely at play causing higher rates of obesity amongst Latino persons. This is because the disproportionate amount of overweight Latinos, adults, and especially the number of Latino men demonstrates that there is a cultural component that is contributing to the obesity rates amongst this group of people. How this may affect the implementation of the purpose intervention is that it may lead to people not trusting information coming from sources outside their culture. The patients may be dealing with additional pressures and may face additional struggles that prevent them from changing their lifestyles. And to address this barrier, the training and coaching will need to include information addressing and sensitive to commonly cited Latino values such as family, personal relationship, beliefs, illnesses, beliefs, spiritually, and values. Sustainability and barriers. In this program, it includes that each patient can, will, and will receive customized help based on their individual needs, which may mean each patient may require more time and resources than what has been estimated. Proposing limits on coaching during the 6 months period and communicating these limits to patient may be a way to set realistic expectation for how much help and assistance they can expect to receive, and may help improve sustainability and the stability of this program. In addition, the study is limited to patients living in California in order to reduce the complexity of finding and following up with patients and hopefully eliminating other factors that may impact the results. As discussed in the previous slide, addressing Latino cultural components that will affect each patient's current lifestyle is important and may require more resources and thus impact the sustainability of this program. Each of these factors impacts the sustainability of the program because if these needs cannot be met, then the study cannot begin. However, if these hurdles can be overcome, then the study should conclude after 6 months smoothly, since the most risk and potentially resource demanding situations will occur at the very beginning of the study. Evaluating program outcomes. Outcomes will be evaluated based on several measures, factors. Weight, body fat, hip, and waist measurements will be taken, as well as their personal body image be inquired about, because each of these variables have been shown to be impacted by obesity. If any of these variables decrease, except for body image, which should increase, then this may provide evidence that this intervention was able to successfully create the outcome it strives to create. What did I learn or found most valuable about this assignment is the question that we had been assigned from the very beginning. I felt I was better able to understand how an intervention question is developed. It's more complex than simply finding a problem and attempting to create a solution, as many more factors like output, outcome, and impact can be examined while developing an intervention, which allows one to tailor a study immensely, excuse me, more than I thought was possible. And then my next slide is just my references. Thank you for watching and listening. Hope to see you guys' presentation.